My name is Elijah Mwaura. I'm a doctor, surgeon working at ChM Urology Hospital. That's in the eastern parts of Kenya, near the slopes of Mount Kenya. It's a rural hospital, but it's a level 5 hospital, both teaching and referral facility. I am a beneficiary of Merck Foundation Capacity Advancement Program, where I did a Master of Surgery in Urology, ChM Urology, from the University of Edinburgh. It was a 2-year program, online based, and was of great benefit to me, being a surgeon who was interested in pursuing urology as my subspecialty and having no urologists in the entire county. So I graduated from the University of Edinburgh in November 2023. The course began in 2021 September, so it was a 2-year program. This is included in the second year, and I can say I emerged the best student in that class. The course was offered in a very friendly way to myself, being online based, and the fact that I could schedule my time for study and for work allowed me to be flexible and to be able to accomplish it well. And there was a lot of learning. The faculty is pretty experienced in this, the matters that they were tackling, the modules that they were engaged in. And I learned a lot, both from the faculty and from also the trainees from different parts of the world. The practice, the snippets they shared of their practice was relevant to me, and I enjoyed it a lot. Since I graduated, I have been able to start a urology clinic at this place, and certainly a urology service that's now vibrant. Even as of here, I'm running a urology clinic today, and many patients have benefited from the service. In fact, I would say last month we had a free urology camp, which was sponsored by one of our partners. And the fact that I am empowered to tackle these patients has helped a great deal, and I think the hospital has had appreciated a lot the added service, and also the patients who we had like 30 surgeries during that camp in a period of 5 days. Yeah. So for me, the added credentials helps me to have the confidence to approach these urology patients. As I would say, before the course, I would still get these urology patients coming to seek service, knowing that I'm a surgeon, but not having the adequate knowledge to tackle these specifically urology patients. So the course has empowered me, and the confidence in me is evident even when I'm treating them. And so it has mutually benefited myself in terms of growing that confidence, and also the patients in the fact that the quality of service has improved, and now I could confidently therefore start a urology clinic, which I could not do before. Because of the personal benefit from it, I would greatly recommend it to my general surgical colleagues who are interested in urology. My only recommendation is, I realized once I finished first year, I realized one gap, that there are things that I was training on the online that I was not able to, I needed a clinical exposure. My recommendation is to Merck Foundation is to consider having a twin, the online program to be twinned with a clinical fellowship for about 6 months in India, so that it can even not only improve the clinical part of it, but also improve our credentialing at Kenya, because that's a requirement for us to have at least 6 months of clinical exposure. To Merck Foundation, I would say this capacity advancement program is impactful. Let me say, for me, the impact I have seen is in just those few months since I graduated is huge, and I would say continue doing it. Do that tweak that I mentioned to improve it by having that clinical component attached to it, and then you will have a big impact in Africa. The cost of these programs are prohibitive I could see my invoices for those programs, and it's not something I would have afforded without Merck Foundation. I am immensely grateful, me and my family and my hospital. Thank you.